Hey, you! Me? You look like a young, capable, intelligent, really ridiculously good-looking person right there. Why not make something out of yourself, buddy? Oh, why, thank you. Like, what should I be there? And give me a reason why I should be. You should be a nurse if you like to help people, make an impact in their lives, like having a challenge, and something that you won't get tired of. Don't trust me? Well, you should check out these three professionals and tell you about their experience in nursing. And we're ready.
Mr. Burton, tell us why you decided to go into nursing.
Well, nursing was a midlife crisis for me. I was in my 30s and was looking for a job, and I'm a very people-oriented person. So I decided to choose nursing.
Dean Huerta, why did you choose nursing?
I chose nursing because I wanted to be able to help people. We have some health issues in our family, and the nurses we came in contact with when I was a child were very helpful and very caring and compassionate with my family. That made a difference in how we viewed our health care.
Mrs. Coletti, why did you choose nursing?
Well, I chose to go into nursing because I really like working with people. I kind of like to talk to people a lot, and I think that because I can help them, I go home feeling really good at the end of the day.
I still work as a nurse today because that's who I am, and that's what helps define me as a person and as a professional.
Choose nursing, and I didn't realize how hard it was going to be. But nursing school was quite a challenge. But it's been very rewarding for me to be a nurse. I love what I do, and I love my patients and love my students. Just have a great time, and it's really neat going to a room full of young people and have every one of them want to hear what I have to say. It's pretty cool. And
for me, nursing made sense, and it's been a very rewarding career. I would encourage anyone who's interested in helping people to think about nursing as a possibility, but realize that it's more than a job. It's hard work. It's hard work to get through school, and it's hard work to pass the NCLEX, and it's hard work to do all the roles that a nurse must do in order to be a patient advocate, to maintain a safe environment for a vulnerable population, because patients who and clients who need us, not just hospitalized patients, need someone who will be their voice and be their translator in a healthcare setting. For me, that was what nursing is all about.
And one patient stands out. His name was Butch. He had paranoid schizophrenia, and the first week in clinical, I was assigned to talk to him, but he refused to talk to me. In fact, I talked to a number of other patients, but Butch wouldn't talk to me. And the second week, same thing. I would approach him, he wouldn't talk to me. But finally, about the fourth week, he approached me and said, "I'm ready to talk now." And he told me all about his life and his medications, and very fascinating. And it just showed me that sometimes the most difficult tasks are the most worthwhile, because Butch became a really great patient, developed a very trusting relationship with me in spite of his extreme paranoia.
Well, every day is a little exciting, and there's something new every day. But a memorable experience was we had a patient coming into us from the ER. She was told she could never have children. She was 43, so she was kind of beyond the typical age to have babies. And she'd been out and was not feeling well. Came in, and the doctor in the ER did an x-ray and said, "Oh my gosh, there's a baby in there," and said, "You need to go to L&D." And she came to us, and about 4 hours later delivered a healthy baby girl. So it was very exciting for them.
How'd that made you feel?
It was amazing. It was just, that happiness you go home knowing that they're so excited, and this is really their dream, something they've never had the opportunity to have. And sometimes when you think that it'll never happen and then it happens, it's even more rewarding.
Okay, that's good. Can you tell us of an experience that has impacted your life and maybe someone else's?
As an advanced practice nurse and a nurse practitioner, my favorite patient group is pediatrics and children. And I had the privilege when I was an ER nurse practitioner to do a lot of pediatric care. Consequently, in my private practice where I'm working in an urgent care, I still see a lot of peds. I learned really early that patient assessment is more than just putting your hands on, taking vital signs, and getting a history. It's listening to the comments made by the client, the patient, and their family. And in pediatrics, it served me well with two different vulnerable pediatric patients who, on assessment, didn't appear to be sick. But listening to the mom's comments about they're not acting right, they're not feeding well, made me dig a little bit deeper and do a few more tests on them, and then refer them to an emergency room physician and or a pediatrician at the hospital for follow-up. And both of those children wound up having a serious medical problem that had I sent them home and not listened to mom, both of those pediatric patients who were less than a year old would have died. So knowing that I was there, that I listened to my faculty members, both in nursing school, who said always listen to parents, always listen to the caregiver, and then I reinforced that as a part of my advanced practice role, made a difference. Those kids are alive today and well because I listened to the mother, and because the physicians listened to me and took my documentation to listen to the mom and admitted both of those pediatric patients to the hospital where they were cared for, and we didn't have complications and consequences of disability as a result.
That was just one of the things that convinced me that I liked what I was doing. And psych nursing is my favorite thing in the world right now. And it's not for everybody, but it can be a part of an experience of helping any nursing student provide really well-rounded care for a variety of patients, including the 20 or 25% of your patients in a hospital that are mentally ill. So, been a fun thing. And teaching was just awesome, helping other people to find the satisfaction that I found in taking care of psychiatric patients.
How did that make you feel?
It made me feel great because often we get in a hurry, and especially when healthcare today, when we have sicker patients than we've ever had and they're in the hospital much less time than they were when I was a nursing student and even when I was an RN working the hospital, it made me feel like I made a difference in their lives. And hopefully the nurses working around me saw that I took that extra time and I listened. I didn't try to rush them through. Emergency nursing, sometimes we get in a bind because we have more patients waiting in the lobby than we have beds for, and we can't move those patients to the floor because the floors are full. So it's easy to just move on to the next patient to try to do the task that we need to do as a nurse. But this made me realize that sometimes that few extra minutes that you spend makes a big difference over time. The reward was tremendous.
I would let them know it's been an amazing career, and it's something that's so flexible that it changes constantly. When I first started, I always knew I wanted to do labor and delivery, but then as I started doing it, I really liked teaching my patients, and then I liked teaching the nurses, and then as it got to be more and more, I just found that teaching was really my love. So I've really evolved through nursing, and everybody has the opportunity to evolve. You will never be bored in nursing. You will always have a job, and you will always do something that you love. And if not, you switch to something in nursing that you still love. So it's always a new adventure.